Hello and welcome back to Local Health Now with Guthrie. I'm Sarah Backwitz, and today, in honor of Breast Cancer Awareness Month, I'll be talking with Dr. Geneva Ballard about screening for breast cancer. Thanks for joining me.
Thanks, Sarah.
So, screening for breast cancer can be quite an arduous process. Tell me about some of the advantages that might come with having a multidisciplinary team and having that extra support.
Sure. So we are aware that the process from being told you have an abnormal mammogram to undergoing a cancer diagnosis and then on towards figuring out the appropriate treatment for that can be really kind of a scary time for women. So we have breast nurse navigators who are available to help and navigate the patient throughout the entire process. The breast radiologists, breast surgeons, breast oncologists, and radiation oncologists all work really closely together to help facilitate the patient moving between each of our subspecialties and really feel like they have a cohesive team approach to their care.
Right. And so to even begin this process, you need an appointment. So how could someone make an appointment to get a mammogram?
Sure. So there's two types of mammograms that we offer. Screening mammography is for patients who don't have any symptoms, who are just looking to undergo the screening process and make sure nothing very early has started to become a problem. So that is the exam you want to be scheduled for if you have no concerns. Patients who do feel a lump or have another kind of concern are going to need to schedule somewhat differently into a diagnostic appointment. And you can make appointments for both of those types of mammograms at 866 Guthrie.
Great. And so some people who might be making an appointment for their mammogram might have some COVID concerns. We are under a pandemic. What advice might you have for them?
Sure. So anytime you're entering a healthcare facility, there's always the concern that patients in the same facility might be sick. All of the Guthrie facilities are following CDC guidelines for protecting our sick and healthy patients in and amidst this pandemic. We're using masks. We're obviously spending a lot of time cleaning surfaces and touch points that might be of concern. And all of our waiting rooms are set up specifically to allow social distancing between patients. So we're doing everything we can to make our patients feel safe and to truly be safe in our facilities.
All right. Well, thank you so much for joining me and sharing this information on breast health, Dr. Ballard.
Thank you.
Yeah. And so make sure to tune in next time for Local Health Now with Guthrie. I'm Sarah Backwitz.